I wasn't desperate. I didn't know what's going on because I thought to myself that I've been left alone. I start to feel my condition degrading.
No, I totally understand your issues because you are not the first one to encounter this problem. Recurrent disc herniation. They remove only the fragment, but you were left unsupported, that's why.
My name is João Carrasqueiro. I'm from Mozambique. I've been struggling with the low back pain since 2013. And I visited many doctors. I went through many treatments. Instead of recovering, I was just getting worse and worse. September last year, the situation got even bad, and I started to look for alternative for doctor. And in October, somebody suggested me to a doctor. I went through the process and visa and all that, and I came to Delhi. In November, I had the surgery. The surgery went well. It was fine. After the surgery, I was okay. On end of November, I went home and I was fine. But 1 week after, I start to feel my condition degrading, having limitation of doing things. My capacity start to get affected. Got to the point that the basic activities inside the house, I could not do it anymore. Took me time until somebody else, which is a cousin, she recommended me Dr. Verma, and I sent my issues, my worries I had, my condition written through the WhatsApp to the doctor, and immediately I got the feedback, and we start to exchange the message, and that just by itself created me hope through the message I was getting, through the feedback I was getting. And eventually we finalized that no, I need to come back to India and to see Dr. Verma. I came. Doctor, thanks for receiving me. I remember when I arrived out of the car to the facilities, I needed a wheelchair.
You were in so much of pain,
Yes,
I couldn't
yes.
remember that. Yeah.
Eventually, it was done on next day. You know, the pain I had on my leg, but from that time everything came back, and I'm really happy. Thought to myself that I've been left alone, and thanks really.
No.
Thank you very much.
I totally understand your issues, which in scientific language we call recurrent disc herniation. Recurrent disc herniation means like this is a primary disc hernia when the disc piece comes out, and by the first surgery what we do, microdiscectomy, we just remove the small piece which is seen here as a red part. If we remove whole of the disc, spine is going to become unstable. So the surgery done by the primary surgeon was a good surgery. They remove only the fragment, but unfortunately 5 to 10% patients do have a recurrent hernia, but that needs to be properly counseled. You need to be told beforehand that there are chances, so you don't have to worry about it, because those patients who have recurrent disc hernia, they do get better. 90% of them do get better. But those who don't get better like you, we have to do a revision surgery. But you were left unsupported, that's why it played on your mind, you were
Yes.
depressed and you were like really bad. I remember when you
Yeah,
came here. So good thing about your case when I studied your disc, MRI, CT and X-ray, was that there was a large fragment which was like entangling your nerve, L5 nerve of the left side. So fortunately next day we did your surgery. Since your age is almost 59, you are approaching 60, your discs were completely collapsed, we had to do the spinal fusion. And I am so happy that after 7 days you are walking comfortably, you are confident. So purpose of making this small video about recurrent disc hernia is the same, because there are thousands and thousands of patients who have been operated before. Getting operated for the first time is a big task, but if the same problem returns again, then you go into a vicious cycle, reverse downhill. So that's the purpose, that there is nothing to worry. If you get good support after the first failed surgery, there is still big hope. Without surgery you can get better, but if required, never hesitate to get yourself operated. And thank you so much for contacting us.
Thank you.
And
Really.
wish you all the best.
Yeah,
Congratulations.
Thank you.
Sir.